All right, everyone, have a good look at this image. What do you see? To a layperson, it's just a bunch of shadows, isn't it? Blacks, whites, and grays. But for you, as a future doctor, this is a story. It's telling you exactly what's happening inside your patient. So the real question is, are you ready to learn how to read it? Okay, let's get started. Today, we're going to tackle a really fundamental skill, something you'll use all the time, interpreting the abdominal X-ray, or AXR as we call it. And listen, this is not about memorizing 100 different signs. No. This is about learning a system, a step-by-step method that will let you walk up to any AXR on the wards and analyze it with confidence. So, here's our plan for today. First, why order one? Then, getting the right view. We'll learn to read the shades of gray, map out the anatomy, and finish with a super important trick, the 369 rule. All right, section 1. Look, before you even think about looking at an X-ray film, you have to ask yourself one simple but absolutely critical question. Why did I order this? You see, every single test we do in medicine has to start with a clinical question we're trying to answer. So what are those questions? Well, these are the big ones. Your patient comes in, abdomen is all swollen, and you can't hear any bowel sounds. You're thinking, could this be a small bowel obstruction, or SBO? Or what if they have that sudden terrible pain and their abdomen is rigid, like a board? That's when you're hunting for a perforation, looking for what we call pneumoperitoneum, that's free air. And of course, there are the simpler things. A child swallows a coin, for instance, the AXR will show it right away. It's also our go-to for making sure things like feeding tubes and lines are exactly where they're supposed to be. Okay, so you've got your question. Now you need to pick the right tool for the job. And in radiology, your tools are the different views you can order. So let's open up our radiographic toolkit and see what we've got. More often than not, this is where you'll start, the supine view. The patient is just lying flat on their back. It's your standard go-to image. Think of it as the basic map of the area. You'll often hear it called a KUB because it gives us a decent look at the kidneys, ureters, and bladder. But, and this is a big but, if your patient is able to stand up, getting an upright view is absolutely essential. Why? It's all about one thing, gravity. You see, when there's a bowel obstruction, the gas inside will rise up and the fluid will settle down. This creates these very clear lines. We call them air fluid levels. And you can only see them when the patient is standing. This view can literally be a game changer for your diagnosis. Now listen up, because this is a top tip, something that will make you look very sharp. When you suspect a big abdominal emergency, like a perforated bowel, the single best, most sensitive view to order is an upright chest X-ray. I know, it sounds strange, right? We're worried about the abdomen, why look at the chest? Well, think about it. Where does free air go? It rises to the very highest point it can find. And in the abdomen, that's right up under the diaphragm. That little sliver of black air is easiest to spot when it's framed by the dark background of the lungs. Don't you ever forget that. Okay, we've got our images. Now it's time to actually learn the language, because that's what reading an X-ray is. It's learning to read a new language written in shades of gray. And the entire alphabet of this language is based on one simple concept, density. Different things in the body block the X-ray beam differently, and that's what creates all these different shades. So let's run through this alphabet, from darkest to brightest. First, you have gas or air. It's black, because basically all the X-rays just pass right through. Next, fat. It's a bit denser, so it shows up as dark gray. Then you have your soft tissue and fluid. Think of your liver, your kidneys. That's all a kind of light gray. Then we get to bone, much denser. It shows up as white. And finally, the brightest of all is metal, a surgical clip, a foreign body. That's going to be an intense, brilliant white. Black, dark gray, light gray, white, brilliant white. That's it. That's your 5 basic densities. Okay, let's put it into practice. Look here on this film. Do you see this bright white structure right here? That's the iliac crest. That's bone. Now contrast that with these patches of pure black in the center. What's that? That's gas inside the bowel. It's that simple. Bright white bone, pure black gas. You see? You're already starting to speak the language. All right, so now that we know the alphabet, let's start forming words by identifying the structures. And here is maybe the most important rule in all of radiology. You must know what normal looks like. If you don't have a clear picture of normal in your head, you'll never ever be able to spot the abnormal. So let's start by mapping out the normal abdominal anatomy. The first big challenge is telling the small bowel from the large bowel. But actually, it's pretty simple if you just remember 2 things: where it is and what its folds look like. So the small bowel is usually right in the center of the abdomen. And its folds, we call them valvulae convenentes, they look like a stack of coins. They're thin and they go all the way across. The large bowel, on the other hand, forms a frame around the periphery, and its folds, the haustra, are thick and lumpy, and they do not go all the way across. So just remember, central with lines all the way across is small bowel. Peripheral with lumpy folds that stop short is large bowel. You have to burn that into your memory. Now have a look at this. This is what a normal bowel gas pattern looks like. You see a little bit of gas scattered about, mostly in the large bowel around the edges. But the most important thing to notice is that the caliber, the diameter of the bowel loops, is normal. It's not blown up or distended. This is your mental picture of normal. Okay, next up, let's find the solid organs. Remember, they're going to be that light gray density. Look up here in the upper right quadrant. This big, uniform shadow, that's the liver. Now go across to the upper left. This smaller shadow here is the spleen. And if you look carefully on either side of the spine, you might just be able to trace out the bean shape of the kidneys. And finally, let's look at the framework holding everything together, the bones. You should always make a point of tracing the bones. Find the spine with its vertebral bodies. See the lower ribs coming in from the sides. Down below, you have the sacrum and the big pelvic bones. These are your landmarks. They give structure to the whole image. Okay, we're at our final section, and I've saved a really powerful clinical pearl for last. This is a simple little rule that you absolutely must remember because it can help you spot a dangerous bowel obstruction right away. It's called the 3-6-9 rule. So what is it? It's simply the upper limit of normal for the diameter of the bowel, and it's so easy to remember. Ready? Up to 3 centimeters for the small bowel, up to 6 centimeters for the large bowel, and up to 9 centimeters for the cecum. 3, 6, 9. Simple. Now, you might wonder, why can the cecum get so much wider? It's a physics thing, the law of Laplace. Basically, a wider pipe can handle more pressure before it's at risk of bursting. But even it has its limit, and that limit is 9 centimeters. And here's the bottom line, the clinical takeaway. If you measure any part of the bowel and it's bigger than these numbers, that's a red flag. It tells you there is dilation, and that is very likely due to an obstruction somewhere further down. That simple measurement might just be your very first clue that your patient has a surgical emergency. So there you have it, a systematic approach to the abdominal X-ray. You now know why we order them, the rate views to get, and what to look for. You've got the fundamentals down. So the next time you're on the wards and an AXR goes up on the viewing box, don't be intimidated. Those shadows are telling a story. And now, you know how to listen. The only question is, what will you see first?